In an effort to get more people traveling, a major Canadian airline says they will now cover emergency medical and quarantine expenses if COVID-19 is contracted during your vacation. Air Canada Vacations announced Monday that a COVID-19 assistance plan designed to cover a range of medical and quarantine expenses for those who contract COVID-19 during travel will be offered free to all eligible travelers starting September 4th. City News hit the streets to ask if free COVID-19 coverage would change your mind when it came to booking a vacation and boarding a flight during the pandemic.
I would definitely be more apt to travel if they provide you with some care.
Yeah, I definitely take that off. I'm fine with traveling right now.
Yeah, I don't think it would cause me to travel. That's not really the concern that I have. It's more about, the destination and how much the risk is there. It's not about the cost for catching COVID. It's more about the risk to the people that I love.
The last thing we want to do is to be sick, to be in the hospital, or to put somebody that we care about in that situation because we are enticed by messaging about a bonus if I go, or a financial type of compensation.
Cynthia Carr is an epidemiologist and founder of EPI Research. She says this type of vacation coverage being offered sits at odds with what Canadian leadership and public health officials are saying about flattening the curve. A recent Angus Reid poll split Canadians into three main categories relating to COVID-19 health and safety compliance. Results show 47% of people were labeled infection fighters who follow COVID-19 safety protocols diligently. 36% are inconsistent, which made them strict on hygiene but loose on travel, and 18% were cynical spreaders, those who disregard most, if not all, COVID-19 safety precautions. Carr says the majority of cynical spreaders were young people who are in the same age group who are statistically more likely to go on vacation right now.
There are really important things to look at when you consider traveling anywhere. And really, it's not about the aircraft itself. It's all of the other environmental factors.
Carr says if you are traveling, consider the differences between the Canadian healthcare system versus the location you are planning to visit. Questions to ask: what are the rates of viral infection and spread in the area? Does that region or community have other existing healthcare impacts currently putting a demand on hospitals? And what are the quarantine protocols and health policies in a specific region if you do find yourself testing positive for the virus while out of country?
It's unfortunate, and it will be confusing, particularly for that group that's already decided that they know it all and they're going to engage in these risky behaviors.
In Winnipeg, Mark Neufeld, City News.